I think a big part of the livability of a region is enough healthcare. We're short in several different areas. I'd say the greatest shortage, the most acute shortage is primary care providers.
The area's really grown. There's increasing need for healthcare, both primary care and specialty care. So we need physicians and providers to come to our area to enjoy the benefits of the Rogue Valley, living here, and the medical community has always been something I've enjoyed being a part of, both here in Josephine County and interacting with some of the Jackson County physicians and providers. So it's a chance for us to work together as medical providers to recruit and promote our area. As a primary care provider, I can't take care of all the people who would like to come in and have a primary care physician. We have nurse practitioners, PAs in our office. We need more capacity. I think it's really important that we expand our access to primary care as well as specialty care, and that's why I think SOAPP is important for recruiting to the area.
As SOAPP members, we engage in advocacy to support rural healthcare all over Oregon. The bills we have put forward, as well as bills written by others that we have endorsed, will help patients and healthcare providers across Oregon. We feel that we are all better together, working to support each other's success in improving our diverse communities.
Southern Oregon is a wonderful place to live and practice, but we're off the radar for a lot of people unless they're from Oregon or Southern Oregon. And so we're just trying to raise awareness. Often as we're talking with people as they come here, they didn't know about it and they're just surprised, like, wow, we had no idea what an amazing place this is.
Getting more primary care providers to this area is so important, for individuals in this area to be able to have access to primary care, for medical specialists to be able to refer patients who need primary care. I really like the way that SOAPP is doing this. What we know is if we can bring providers to this area once they get here and they live here and they love it, they'll stay. They may switch between organizations, but they're here in our community, and that's especially what's important from a public health perspective, is that we have some access for everyone who wants and needs it.
My wife and I moved here right out of residency from Iowa, and we got off the airplane and it was February and 55 degrees and the pine trees were beautiful and smelled like pine trees. And we got off the plane and said, well, we're staying. This place is just too good to be true. We love skiing, cycling, camping, the outdoors. We had 2 children who we raised here and had a great experience with the community and the school system.
In the SOAPP meetings, they talk about what's going on in Salem. It's good to hear what happens to our ideas when they get up to that political playing field, because it helps us have a better idea of, what's worth fighting for today and what's maybe better left until tomorrow. We have long heard, especially prior to SOAPP, that I can't get a doctor, I can't get a PCP. And so we want to address that so that when people need them, it's not waiting for a month or 2 or longer.
So we got a lot of initiatives going on right now. One of the problems we have in Southern Oregon and other rural areas of Oregon is the way that primary care physicians are counted. There's no determination whether they're actually seeing patients or not, or if they're doing primary care. All our physicians are counted as primary care, which they're not. The hospitals are counted as primary care. And so our last legislative bill that we sponsored was an effort to force the OHA to do a meaningful count. How many people are really seeing patients and get an accurate count.
We've heard from our broader community repeatedly that improved access to healthcare is one of their highest priorities. That also contributes to my motivation. I think it's really important to listen and respond to our local community. We already have some really amazing providers doing that work, and we need more of them. By recruiting more PCPs, I really believe that we'll be able to positively impact our community in that way. Come visit Southern Oregon, get to know us.
So if you want to expand your horizons, this is a really good place to do it because it's got a couple of pretty good-sized cities with support, and then there are also the outlying areas where you could really spread your wings.
We were able to bring a duo to the Rogue Valley, and they were able to interview with all of the other clinics that are part of SOAPP. I'm happy to say that we actually landed both of them. So we encourage you to come to the Rogue Valley, see what we have to offer. We really look forward to meeting you.